So yeah, hello everyone. So we will be discussing the MCQs, and question is, the first question we have, it's an abdominal examination during a routine antenatal checkup gave a positive Scalvartis sign. So what could be the most probable cause? And the options are concealed abruptio placenta, vasa previa, posterior placenta previa, it's a cord compression. I will repeat, basically it's a case of it's a OBG case, and there is a positive Scalvartis sign. So when you have a positive Scalvartis sign, diagnosis will be what? What is the most probable diagnosis? So the options are concealed abruptio placenta, vasa previa, posterior placenta previa, it's a cord compression. Anyone wants to answer this? Basically there is a positive Scalvartis sign. Scalvartis sign is basically when you compress the fetal head over the pelvis, there will be decrease in the heart rate. So yeah, the slowing of the fetal heart rate on pressing the head on the pelvis is Scalvartis sign, and we have to tell what is most probable cause for Scalvartis sign. And the options I told you, it's concealed abruptio placenta, vasa previa, or it's posterior placenta previa, or it's a cord compression. Anyone? So yeah, okay, the answer here is it's a C, that is in placenta previa basically we see a Scalvartis sign. So yeah, so Scalvartis sign I told, it's a decrease in the fetal heart rate when you pull it and below the pelvis. So yeah, next question we have, it's a 24-year-old man, posterior, the posterior is the right answer. So yeah, next question we have, it's a 24-year-old man who is diagnosed with PID, that is pelvic inflammatory disease, and which of the following is not included in this condition? Endometritis, oophorytis, cervicitis, or it's a peritonitis. Basically, if you know the definition of PID, you can tell this answer. So I will just repeat, it's which of the following is not included? It's not included in the PID: endometritis, oophorytis, cervicitis, or it's a peritonitis. Anyone? So yeah, anyone wants to answer this? So basically the answer is, anyone? Okay, I will tell this answer is C, that is cervicitis, because PID is basically, it's not a, it's upper genital tract. Yeah, peritonitis, no peritonitis. See, because cervicitis is basically, it's PID is basically, it's an inflammation of upper genital tract. So you have cervicitis and vaginitis as a lower genital tract. So that's why cervicitis is the right answer, and endometritis, oophorytis, peritonitis will be upper genital tract. So yeah. Next we have, which is the most common cause of secondary Parkinsonism? And the options are infection, vascular, neuroleptics, or it's a trauma. So yeah, anyone wants to answer? You might be knowing this answer. What is the most common cause of secondary Parkinsonism? Options are infection, vascular, neuroleptics, or it's a trauma. Anyone? I can just give you a hint that it's a drug-induced Parkinsonism. Now at least you can tell. It's infection, vascular, neuroleptics, or it's a trauma. Okay, the answer here is, okay, no one wants to do, the answer is neuroleptic, because we have seen there is a drug-induced Parkinsonism. So yeah, in drug-induced Parkinsonism and neuroleptic, that is the dopamine blocking agents will be present, are the most common cause of secondary Parkinsonism. And you all know what is the secondary Parkinsonism. Secondary basically is not, there is a primary cause for this. And secondary, we have the options, we have drug-induced, tumor will be there, post-encephalitic PD, and neuroleptics is the right answer. Then head trauma, vascular, it's a liver failure. So yeah, the most common is neuroleptics of the secondary Parkinsonism. Next question we have, which of the following is a minor criteria for diagnosis of rheumatic fever in a low risk population? And the options are carditis, erythema marginatum, subcutaneous nodules, or it's a polyarthralgia. I will repeat which of the, basically you know there is a major criteria and the minor criteria for diagnosing a rheumatic fever. So yeah, you have to tell which is the minor criteria, that too for a low risk population. And the options are carditis, erythema marginatum, subcutaneous nodules, or it's a polyarthralgia. Anyone? Which is a low minor criteria? So yeah, we know it's a Jones criteria. We know, if you know the Jones criteria, you know there is a major criteria and there is a minor criteria. So yeah, its answer is D, that is the arthralgia is the minor criteria. D is the right answer. It's a minor criteria for diagnosis, that too in the low population. So yeah, Jones criteria, for low population, for high population there is a Jones criteria. And yeah, it's carditis, arthritis, chorea, erythema marginatum and subcutaneous nodules. And minor is it is poly or hello. So for minor it is polyarthralgia or it's a monoarthralgia, that is according to the population. So yeah, but you have to know what is the major criteria. Major is carditis, arthritis, chorea, erythema marginatum and it's a subcutaneous nodules. So who is this? Yeah, okay. And then next we have, it's a methyl dopa. Methyl dopa is primarily used for which of the following conditions? And the options are hypertension in pregnancy, vestibular hypertension, hypertension with gout, or it's a refractory hypertension. Anyone wants to answer this? Methyl dopa is primarily used for which of the following conditions? Methyl dopa, it's basically in which? Anyone? And dopa? Okay, we'll just repeat the options. It's hypertension in Parkinson in pregnancy, renovascular hypertension, hypertension with gout, or it's a refractory hypertension. No, we don't use in refractory. Yeah, hypertension in pregnancy is the right answer here. Methyl dopa is preferred for chronic hypertension, in pregnancy that too. So yeah, A was what? No, D was high refractory. No, we don't use in refractory. So yeah, you have to remember it's a methyl dopa in chronic hypertension, that too in pregnancy, based on safety and efficacy for both the mothers and the fetus. We use that. So yeah. Okay, anyone can tell which is the first line drug for hypertensive emergency in pregnancy? If there is a hypertensive emergency in pregnancy, which drug will use? The methyl dopa. Anyone? Just tell me the drug of choice for hypertensive emergency in pregnancy. Okay, I will just say it's a levodopa. So yeah, it's a beta blocker and levodopa is the safest drug in hypertensive emergency in pregnancy. So next we have, you see a middle-aged man presented to a psychiatric OPD with clinical features of speaking to himself. Herein two people talk about him, reduced affect and impaired judgment, which is present for more than 6 months. So what is the likely diagnosis? Yeah, levodopa was the right answer. So yeah, I was just talking about it's a middle-aged, it's a levodopa, I got it. So yeah, you see a middle-aged man presenting to a psychiatric OPD and with clinical features of speaking to himself. Herein two people talk about him, reduce, it's diagnosis that only. Reduced affect and impaired judgment, which is the present for more than 6 months. So what is the most likely diagnosis? And the options are schizophreniform disorder, schizoaffective disorder, schizophrenia, or it's a schizoid personality disorder. So yeah, schizophrenia, from the starting only we can tell it's a schizophrenia because there is dual personality. And when you see a patient about dual personality and with that too with all this hallucination and all that, people talking about him and all, that too for more than 6 months, you term it as schizophrenia. So yeah, there are negative and positive, you might be knowing. So next question we have, it's a pathology question. Yeah, 50-year-old man admitted to the ICU developed sepsis 3 days after insertion of a central venous catheter and a peripheral smear was given. So what does the structure mark in the arrow given below? Basically I cannot tell. How will I give a hint? I cannot tell you this question. Okay, I will just tell what is there in the answer. Basically it's a peripheral smear which has Doyle body. So you might be knowing Doyle body, about anything about Doyle body. It's basically seen in bacterial sepsis. So it's a reactive changes in neutrophils, and the answer is that one, that in Doyle body is the right answer. So there is an image below which I cannot show you, but yeah, it was a 50-year-old man admitted to the ICU with sepsis 3 days after insertion of central venous catheter, and you see a Doyle body in the catheter induced infection, and you see a Doyle body in the peripheral smear. So it's a case of bacterial sepsis. Next we have, it's a patient exhibited an unsteady grunt-like gait, and the physician noted that he swayed while entering the examination room. So which region of the cerebellum was marked lightly affected by the bleed? And the options are flocculonodular lobe, spinal cerebellum, cerebellum, or it's a superior vermis. I repeat, it's a patient who comes to you with an unsteady grunt-like gait. Basically, he has been drunk or something like that, and the physician note is showing while coming to the examination room, and which region of the cerebellum is most likely affected because of the bleed. Basically, it's a case of stroke. So your option is flocculonodular lobe, spinocerebellum, cerebrocerebellum, or it's a superior vermis. Anyone just can guess. We don't know the answer. It's involved in the unsteady grunt-like gait of the patient. Spinocerebellar. No, it's a flocculonodular lobe, also called it as vestibular cerebellum. So there is a division of cerebellum. Yeah, it says vestibular cerebellum, spinocerebellum, and the last one is cerebrocerebellum. So yeah, the answer is flocculocerebellum, and flocculocerebellum will basically lead to a swaying movement in the patient, and it's a grunt-like gait. Basically, it is concerned with equilibrium and gait, so that's why the answer is vestibular cerebellum, or it's a flocculonodular cerebellum. So yeah, it happens. Wrong answer many times or most of the times we have a wrong answer. So yeah, next question we have: a 10-year-old boy is brought for the evaluation of fatigue. So on examination, his jaundice, mild splenomegaly is there. He was adopted, and his family history is unknown. So peripheral smear is shown below. What is the most specific investigation for this condition? So they have given what is the investigation of choice basically, and it's a case of a peripheral smear is there. It's a hyperchromic RBC with loss of central pallor or spherocytes. So basically it's a case of spherocytes. When just it is a case of hereditary spherocytosis. So yeah, now you can tell what is the most specific investigation for hereditary spherocytosis, and the options are eosin 5 maleimide test, or acidified glycolysis test, osmotic fertility test, or it's a Nesterov test. Anyone? Basically it's a case of hereditary spherocytosis. What is the most specific investigation for this condition? If you know the answer, its options are eosin 5 maleimide test, acidified glycolysis test, osmotic fertility test, or it's a Nesterov test. Anyone? So yeah, hereditary spherocytosis, jaundice will be there, mild splenomegaly is there. Okay, the answer here is, I will tell you the answer here is eosin 5 maleimide test. So yeah, it's a factual question, how to remember. It's a eosin 5 maleimide test, which is the most specific test for hereditary spherocytosis. Yeah. Next question we have, it's a patient who is suspected to have an enteric fever, is brought to your clinic by the brother. Glycolysis. So yeah, he tells you that he had already been started on ceftriaxone by his village quack 2 days back. So which investigation will you order to confirm a diagnosis at this stage? Basically, basically it's a case of enteric fever, and see, you are telling which question. Last question you are only there. See, for the last question it's A only, that is eosin 5 maleimide test. I think you are getting the question late. I think that's why you are replying late. I think. Yeah. Okay, we move on to the next question where I was. The answer is answer was A, that is eosin 5 maleimide test. So yeah, where I was, it's a patient with enteric fever, and he has been started by ceftriaxone by a quack 2 days back. So which investigation will you order to confirm his diagnosis? So the options are blood culture, bone marrow culture, or stool culture, or urine culture. So yeah, basically it's a very simple case. It's an enteric fever. 2 days back a patient comes to you and he has been taking ceftriaxone, and what is the investigation of choice at this condition? That is 2 days back after taking antibiotics. Blood culture, bone marrow culture, stool culture, or it's a urine culture. Yeah. So yeah, the answer is anyone? Blood culture, bone marrow culture, stool culture, it's a urine culture. Okay, the answer is B, that is the bone marrow, because like others what they have given is blood culture or stool culture or urine culture, it won't be there. No, stool, it won't be there. Stool deals positive result from 2nd to 3rd week. So yeah, after third week or second week you will get a stool culture positive, whereas blood culture also you won't get because antibiotics you are already given, and the urine culture is also after second week. So the options, blood culture, blood culture is there, but what I told you, it's sensitive. It is sensitive, but basically you are given antibiotics, so yeah, it won't be there. So yeah, stool culture after second or third week, urine culture after second week. So the most right answer here is bone marrow culture. That is, it remains positive for 5 days even after antibiotics. So yeah, it's gone. Next we have, it's a 5-year-old boy had painful sores in the mouth with a rash over the hands along with fever. So which of this is a causative agent? So it's a pediatric question. It's a 5-year-old, painful sores in the mouth with a rash over the hands along with fever. So which of this is a causative agent? And the options are Poxvirus, Kawasaki virus, HSV7, or it's a parvovirus. So anyone? Poxvirus, Kawasaki virus, HSV7, or it's a parvovirus. It's a pediatric question. 5-year-old boy, painful sores in the mouth with rash over the hands and along with fever. So anyone? Poxvirus, Kawasaki virus, HSV, or parvovirus. Anyone wants to answer this? Okay, the answer is no one wants. Okay, the answer is B. It's not. Basically, it's B. That is Kawasaki virus. Yeah, B is the right answer. Kawasaki virus is the right answer. Basically, it's a hand, foot, and mouth disease, most commonly caused by that Kawasaki virus. Yeah, Rupik is there here. So yeah, it's the most common in children. It's spread by droplet and fecal contamination. The incubation period is 7 days. So basically, yeah, it's a hand, mouth, and foot disease. Or what I told is no, it's not parvovirus. It's a Kawasaki virus, and it is spread by droplet and fecal contamination in 7 days. Yeah, okay. So next question we have, a patient is there who presents with itchy serpiginous eruption as shown in the image. So he sees that these lesions advances rapidly to different sites. So what is the primary mechanism of action of the drug preferred for this disease? This is, you have to tell the diagnosis. Without diagnosis you won't tell this. I will just repeat. It's an itchy serpiginous eruption as shown in the image. He says that the lesions have advanced rapidly to different sites. So what is the primary mechanism of drug preferred for this condition? Basically you have to tell what your diagnosis, otherwise you won't tell. Anyone want to tell the diagnosis? If you just think. Okay, I will only tell. It's a case of strongyloidosis. Yeah, it's a strongyloidosis. And the drug of choice is, now you can just tell me the drug of choice for strongyloidosis. Anyone? The image is showing larva currents and it's a case of strongyloidosis. Anyone, what is the drug of choice for strongyloidosis? Okay, no one wants. It's okay. Basically, it's a ivermectin is the drug of choice for strongyloidosis, and here what was the mechanism of action? Mechanism of action is activation of glutamate gated chloride channels. So yeah, you have to remember this. What is the mechanism for ivermectin? That is activation of glutamate gated chloride channels. So yeah, this you can tell. It's an easy one. If you know the answer there only. Yeah, ivermectin. Yeah. The next question is, Saturnian gout is seen in which condition? Lead poisoning, cadmium poisoning, beryllium poisoning, or it's a mercury poisoning. So yeah, if anyone can tell, Saturnian gout is seen in which condition? Lead poisoning, cadmium poisoning, beryllium poisoning, or it's a mercury poisoning. You can just guess if you want. Anyone? Okay, the answer here is, it's a B. No, it's a A. That is, lead poisoning is the right answer. So because lead poisoning you see as Saturnian gout. That is chronic lead poisoning, not normal. It's a chronic lead poisoning case. And gout, in gout basically tophi will be there. See, in gout there is a difference between gout and rheumatoid arthritis. In rheumatoid arthritis basically you will have symmetrical, and in gout it can be unilateral. And the most common there will be, what I know is, there will be more pain in gout and fever will be there, and tophi is the diagnostic feature of gout. So yeah, here also it is in the knee, and it's more common in the knee, and the tophi will be rarely develops here. So yeah, it's a Saturnian gout which is in chronic lead poisoning. So you have to remember this. Yeah. Next we have a pedestrian was brought to the casualty after being hit by a bumper of a car. So X-ray shows the fracture of the lateral condylar tibia. So what is the mechanism of injury causing this fracture? So its options are varus force, combination of axial loading and varus force, or it's a combination of axial loading and varus force. So yeah, if you can tell this, it's orthopedic case and the X-ray shows fracture of the lateral condyle of tibia. So yeah, if it's a lateral condyle of tibia, then you can just think it's a varus combination of axial loading and varus force, or the last one is a combination of axial loading and varus force. No, it's not varus. Yeah, the answer here is it's a combination of both axial as well as the varus, not varus. So lateral condyle fractures are usually, yeah, what I told, it's the weight of the person. See the weight, sorry, varus it will be. Because it's a combination of both. It's a combination of axial loading and varus force. Because see, if the weight of the person is there, so weight of the person will act as an axial force, where the lateral blow the car will be giving, it will be a varus force. So yeah, it will be both then axial and varus force. Both will cause the lateral condyle fracture. So next question we have here, which of the following is true about glycolysis? So yeah, glycolysis, which of the following is true? It occurs in mitochondria. It's a complete breakdown of glucose. Then we have, it's a conversion of glucose to 3 carbon units, or it's a 3 ATPs are utilized in the anaerobic pathway. So yeah, I repeat once again. I know I am fast, I will be slow. Which of the following is true about glycolysis? It occurs in mitochondria. Complete breakdown of glucose. There is conversion of glucose to 3 carbon units, or it's 3 ATPs which are utilized in the anaerobic pathway. Anyone going to try? It's a biochemistry. I know no one will know this. If you know, it's very good for you. So anyone wants to answer this? Okay, the answer is C, that is conversion of glucose to 3 carbon units. If the right answer, that is true about glycolysis. 4. No, it's not 4. It's a 4. What was 4? It's a 3 ATPs are utilized in the anaerobic pathway. No, it's basically not 3 ATP. It's 7 ATP, I think. No, 2 ATP. It's for glycolysis it was 7 ATP, but for the anaerobic glycolysis it is 2 ATP. So it's not option 4. It's option C, that is conversion of glucose to 3 carbon units. So yeah, you have to remember this, the net ATP used for anaerobic is 2, for aerobic glycolysis is 7. So yeah, like that. So next we have, in recent years, what is the most commonly performed bariatric surgery? So yeah, I've read this. Options are Roux-en-Y gastric bypass, biliopancreatic diversion, laparoscopic gastric binding, or it's a sleeve gastrectomy. So the question is, in the recent years, what is the most commonly performed bariatric surgery? Bariatric basically for obesity you do. So it's Roux-en-Y gastric bypass, biliopancreatic diversion, or laparoscopic gastric binding, or it's a sleeve gastrectomy. D is the right answer. Sleeve gastrectomy is the most commonly preferred bariatric surgery. Next question we have, it's a long question, I think. Yeah. A newborn infant develops respiratory distress 2 days after birth. So on examination she is mottled and has weak upper extremity pulse and absent femoral pulse. Investigation reveals it's a coarctation of aorta. So which of the following drugs can be used to keep the ductus open medially before the surgical repair? The options are trometamol, indomethacin, alprazolam, or it's a morphine. So yeah, it's a big question. It's a newborn infant respiratory distress 2 days after birth, mottled with upper weak extremity pulse and absent femoral pulse. Investigation raised coarctation of aorta. Which of the following drugs can you keep to keep the ductus open medically before the surgical repair? So yeah, indomethacin is not the answer. I'll just tell no, it's not indomethacin. The options are Trometamol, indomethacin, alprazolam, or it's a morphine. So yeah, the answer here is C, not A, not B, it's C. That is the alprazolam is the right answer. Basically it's a PEG1 analog and we use that to open the ductus. So yeah, if you want to know the mechanism, it's like basically it's a case of ductus arteriosus. By now you might have known, but yeah, basically it's functionally closed at 10 to 15 hours after birth and anatomically closed at 10 to 21 days after birth. So yeah, so I also don't know this. Yeah, in patient with patent ductus arteriosus, the ductus is closed medically by NSAIDs, like all that. But yeah, the answer is alprazolam, not indomethacin. Okay, yeah. Okay. Indomethacin is used in case of patent ductus arteriosus, and basically as alprazolam is used in the case of which we are seeing here is ductus arteriosus. So what is the difference? I am only confused. Sorry. I will also read and tell next time. So yeah, next question we have: in which of the following condition would you expect to see a Grissner sign? So Grissner sign, in which of the following condition you will see? It's Parasites, meningitis, sigmoid sinus thrombocytis, or it's a cerebellar abscess. Anyone? Yeah, I will also read and tell later. That one, yeah. Next we have: in which of the following condition would you expect to see a Grissner sign? Parasites, meningitis, sigmoid sinus thrombosis, or it's a cerebellar abscess. This you might be knowing, but I know this. You might know. So anyone? It's a case of. Okay, I will tell. It's a Grissner sign. Basically, it's seen in sigmoid sinus thrombosis. Basically, there is a mastoid tenderness and edema will be there. So yeah, the answer will be sigmoid sinus thrombosis. It's a secondary to thrombophlebitis of the mastoid emissary vein. So the answer is Grissner sign, seen in sigmoid sinus thrombosis. Next question we have: which of the following statement falls under the National Tuberculosis Elimination Program? And the options are: continuation phase for new sputum smear positive, that is HRE for 16 weeks, intensive phase for sputum smear positive after loss to follow-up, HRZD for 8 weeks, or it's a continuation phase for sputum smear positive recurrent phase, HRE for 16 weeks, or it's an intensive phase for sputum smear positive for failure of treatment, HRZDS for 12 weeks. Yeah. Which of the following statement falls regarding the tuberculosis program? So I won't tell all the detail again. So basically, see if there is a new case for it's RNTCP. Yeah, it's not RNT. Yeah, it's a National Tuberculosis Elimination Program, that is NTEP. So in that, if there is a new case of TB, what you do is a HRZD. Yeah, it's a 2 months HRZD, and the continuation phase will be 4 months. That is HRE. So there is an intensive phase and there is a continuation phase. For intensive phase, we give HRZD for 2 months. And continuation phase we give 4 months HRE. So yeah. Next we have last 5 questions. I will not bore you much. See, next we have you are posted as a visiting ophthalmologist and a district hospital as a part of RBSK program. So while screening neonates for retinopathy or prematurity, which of the following would you include under threshold disease? I don't know why they are giving long questions. Options are only long. Just tell me the diagnosis here is threshold disease. Yeah, threshold disease. So just tell me what is the drug of choice what is the surgery of choice for threshold disease? Treatment of threshold disease is. It's a very long question. Threshold retinopathy, yeah. Anyone can tell? What is the surgery of choice for threshold retinopathy of prematurity? Okay, I will only tell it's a big question. It's a laser photocoagulation. Laser photocoagulation is the surgery of choice for threshold retinopathy of prematurity. Now I think it's a small one. Yeah, it's a small one. See, what hypothesis that one X chromosome, maternal or paternal, is randomly inactivated during development? Lyon, Hardy, Maxwell or Barr? Anyone? What hypothesis states that one X chromosome, maternal or paternal, is randomly inactivated during development? Lion, hardy, mature, or it's a bear? I want to tell this. Basically, it's an inactivation of the X chromosome. So, in which hypothesis you see inactivation of the X chromosome? Lion, hardy, mature, or it's a bear? Okay, I will tell it's basically lion. Lion is the right answer. In lion, you see there is an inactivation of the X chromosome. You have to remember this. There is no choice. Different hypotheses with names. So yeah, next we have for epidural anesthesia. What is the maximum dose of lidocaine with adrenaline that can be given to a 70 kg patient? And the options are 175 mg, 200 mg, 350 mg, or it's a 500 mg. So yeah, it's a epidural anesthesia, maximum dose of lidocaine with adrenaline that can be given to a 70 kg patient. 175 mg, 200, 350, or 500. You can tell if you can tell anyone. Okay, the maximum dose you can give. Okay, I will tell the maximum dose you can give is 500 mg for lidocaine with adrenaline. So it's like 7 mg per kg. Okay, so here it is 70 kg. So it's like 7 mg per kg, 7 into 70. So approximately it's 500 mg is the right answer. So you have to remember the maximum dose of lidocaine with adrenaline you can give is 7 mg per kg. So yeah, if it's a 70 kg, then 7 into 70, that is 49. But yeah, overall they are given it's a 500 is the right answer. No, 500. You have to remember it's 7 mg per 7. Sorry, it's 7 mg per kg. So yeah, it's a 70 kg. That's why it's 500 here. And next question we have, it's a patient has rushed to your clinic after she sprayed hot tea on her hand. What should be the ideal temperature of water used to cool her injuries? 0 to 4, 15, 20, or it's a 25? Anyone wants to tell this? A patient comes to you, it's a case of burns, and in that basically she sprayed hot tea over her hand. So what is the ideal temperature of water you should give to cool the injuries? 0 to 4, 15, 20, or 25? Anyone? So yeah, its answer is anyone wants to answer this? 0 to 4, 15, 20, or 25? So yeah, its answer is 15 degrees, because 15 degrees plays a role of analgesia. So that's why we give it's plays a role of analgesia, as well as it delays the microvascular damage in burns. So you give 15 degrees Celsius water to a patient with burns, and to prevent hypothermia we don't give less temperature than that. That's why. So it should be occur for minimum 10 minutes and effective up to 1 hour for a burn injury. So next we have spermatogenesis is completed in approximately dash days. The options are 154, 34, 44, and 74. I repeat, spermatogenesis is completed in approximately how many days? And the options are 154, 34, 44, or 74. So yeah, if you know the answer, then only you can tell me. Anyone wants to answer this? So yeah. Okay, the answer is, okay, no one knows. So basically you have to remember this, it's a 74. In 74 days, spermatogenesis, basically the whole cycle completes in 74 days. It's approximately 74 days. So yeah, next question, last question for today. The question is, they have given a X-ray here. Yeah. See, the question is, in a patient with pneumonia, what is the most common causative organism that can lead to this? 74 what? Right, last question we're telling. Last question was, yes, 74 only, yeah, sorry. Yeah, 74 is the right answer. See, next question I've got, in a patient with pneumonia, what is the most common causative organism that can lead to this condition? Basically, the condition is, in the X-ray they have given pneumatococcus. So in pneumatococcus, you have to tell what is leave that all that. Just tell me what is the most common causative organism in pneumatococcus. And the options are Staphylococcus aureus, Klebsiella, Pneumocystis cerevisiae, or Streptococcus. So I repeat, what is the most common causative organism for pneumatococcus? The options are Staphylococcus aureus, Klebsiella, Pneumocystis cerevisiae, or Streptococcus. The last question, just randomly tell. You don't know the answer also. Anyone? Pneumatococcus are basically what? They are basically air-filled cystic spaces. Yeah. Okay, I will tell the answer if you don't want. It's the last question, and the answer is the most common cause for pneumatocyst is Staphylococcus aureus. Yeah. So yeah, it's over for today, and yeah, I hope you got some answers. Yeah, it's a Staphylococcus aureus. Option 4. No, it's Staphylococcus aureus. So yeah, Staphylococcus aureus is the right answer. So yeah, we finished for today. So yeah, thank you so much and take care. Bye.